In your morning medical news, a new poll shows that as measles misinformation spreads in the U.S., most people aren't sure what they believe. It showed nearly 2/3 of adults have heard the false claim that the measles, mumps, rubella vaccine causes autism. About a third have heard the false claim that the measles vaccine is more dangerous than the disease. Adults are more likely to say these claims are definitely false than definitely true, but many remain less than convinced. At least half of adults express some level of uncertainty by saying the false claims are either probably true or probably false. Another new study suggesting that having metabolic syndrome may raise the risk of developing dementia at a young age. Researchers found those with metabolic syndrome were 24% more likely to develop dementia before the age of 65, but they do want to note that the study was observational, meaning the authors can't say metabolic syndrome causes dementia, but the study only shows an association. Experts say some parents may be waiting too late to talk to their kids about puberty. According to CMOT Children's Hospital, a poll on children's health, roughly 41% of parents say they talked with their child about puberty only when prompted by the child. One of the poll's directors says this can lead to confusion and anxiety in children, especially if they feel their parents haven't prepared them. A new report shows while overall cancer death rates continue to decline, cases are increasing among women and young people. Stephanie Stahl reports.
Melissa Davis was just 30 years old when she was diagnosed with breast cancer.
It was just a time when I was just living my young life. I wasn't thinking about cancer or anything like that.
The South Jersey mom is part of a new trend, according to a new report. More women being diagnosed with breast cancer and surviving.
Every time I hear that, it gives me encouragement because I'm like, you can live with stage 4 and be a 20+ year survivor.
The new report in the journal Cancer shows a steady decline in cancer deaths from 2001 through 2022.
This is because of better detections and new treatments that have come out.
Dr. Christina Annunziata with the American Cancer Society says cancers related to smoking are down because fewer people are lighting up, but there's been an increase in cancer related to obesity, things like breast, pancreas, and kidney cancers, and in people under the age of 50. Why do we think there's been an increase in the number of younger people being diagnosed with cancers?
Well, that's certainly a topic for more research. I don't think we have a clear answer of that.
What is clear? Cancer screenings save lives. And the report says there was a disruption in things like mammograms in 2020 because of the pandemic. Cancer incidents were down that year and have now returned to expected levels.
It's challenging, very challenging.
For Melissa, who's 40 now with 3 children, she's had a second bout with cancer.
I just have to, maintain a balanced, healthy life with medication for the rest of my life.
Now, all about living with cancer, like so many others.
The report said racial disparities have not eased. One example is Black women have a 40% higher risk of dying from breast cancer than white women do.